Should ApoE4 carriers avoid all dairy?
I don't personally think so. I think, let's talk about ApoE44s and pesticides because I think not all dairy is created equal. Just like I'd rather someone with an ApoE4 variant, one or more copies, have sufficient amount of omega-3 fatty acids, again, from fatty fish. Some people can take supplements. A lot of people my patients, they eat fish twice a week. They still omega-3s are low. People with one or more copies of the ApoE4 variant need omega-3s. And a good way to get omega-3s, aside from fish and supplements, could be from grass-fed milk. So, as my mom would say, everything in moderation. I'm okay with E44s drinking milk. I think the question here is like, well, what else about the milk? If it's not grass fed, which is, by the way, more expensive, harder to find, less fresh, and you got to balance that out. But when it comes to is it organic? Are there pesticides? And in the United States or Canada, there's we don't have to worry about this DDT or DDE. It's a metabolite. People with one or more copies of the ApoE4 variant that are exposed to pesticides in foods increases your risk of dementia and Alzheimer's by sixfold, 6 times, which is crazy. Now, in US and Canada, again, legacy contamination, these were banned in the late 70s, so there shouldn't be any there. But whether you're having produce from outside of the country, if you're traveling, if you don't live in the United States and you are living in a country that may have pesticides, then you may want to choose organic milk, and you want to know where the milk and the farms are coming from. So I think the devil is in the details. I think some of it is a fat question, some of it is a quality of fat question, some of it is a pesticides question, and when in doubt, everything in moderation.
I like that.